When someone comes to LSSI in need of help, they have to bring to us some of the most vulnerable parts of their life. When our staff, when our social workers can meet them there, it's really a sacred exchange, and that's the mission. I am Ruth Jajko, Chief Operating Officer at LSSI.
Why did you become a social worker?
I think I became a social worker because I believed in the adage of to whom much is given, much is expected. And I grew up in a really loving, stable home. And so I was kind of looking for a way to give back when I thought about my career. And then when I got into social work and started learning about it, I really liked the person in environment perspective, which is the idea that there's the person and they might have individual needs or individual things that they want to change, goals, but they're also in a broader context in their environment. So you have to think about their family system and their community and social injustice that might be impacting them. And so that just made a lot of sense to me that people may want to change, but you also have to look at the broader context where they are and really help them within that context, make changes in the system that support the individual changes that they're making as well. So social work kind of balances those two perspectives, which just made a lot of sense to me. Talk
about your journey at LSSI, how you got started here and how you got to where you are now.
Well, I started at LSSI in 1994 as a child welfare supervisor. Previous to that, I had been a SAS social worker, mobile crisis with youth at Metropolitan Family Services. So I was coming from mental health and I got a child welfare supervisor job. And I'd had an internship in child welfare, but I really did not know the nitty-gritty details of child welfare casework. And so I was really in over my head. And I had a team of caseworkers that were continuously asking me questions that I had to say, I don't know, but I'll figure it out. And luckily there was another supervisor in the office who really took me under her wing and taught me the ropes of, how to track things, how to keep track of everything that was going on my cases, how to support my staff. But both of those things were really valuable lessons because learning how to say, I don't know, but I'll find out is something that I've had to rely on throughout my career because every time you move into a new role, you're back in that learning mode of having to learn your new job and also relying on others, relying on colleagues, learning from other people. I also learned that if I would ask my staff person, what do they think is the right thing to do, that they often had the right answer and they just needed some support and guidance and brainstorming to get to the where they needed to go. So all of those things were really valuable to me that I learned in that first role. And then I had an opportunity to be the program director with that program and just subsequently moved into other leadership roles within CCS, Children's Community Services at LSSI. And then a few years ago, Mark had invited me to think about taking a role that was broader and looking at the whole organization. And that was great because I was eager to learn, another role, a new challenge, and to learn about the whole breadth of LSSI was really great and very exciting. But I had to go right back to the beginning of saying, I don't know, but I'll figure it out because there's a lot to learn as I started to get to know the other networks.
So how did all of that work as a social worker prepare you to take over as COO?
Well, I think, as I said, social workers are trained to see the whole picture, to look for strengths, to think about people and the system that they're embedded in. And so I think all of those things really work well for the role of Chief Operating Officer. In my career, at this stage in my career, for really many years in my career, I no longer directly impact clients. All of my client impact comes through other people. And so I think that the social work skills that I learned just helped me think about, what do our teams need? How do we cultivate a healthy environment where people are set up for success in terms of our staff, being able to reach their potential, being able to do what they do best. So just really trying to think about how do we create those kinds of environments and put the right resources in place. I really love mentoring and looking for emerging leaders and helping them. I love it when people surprise me with their strengths and they have a great idea and we can build on it or incorporate that into something that we're working on. So I think all of those things have helped me in this role.
We have a lot of different positions at LSSI across the state. Social workers obviously play an important role. How do they specifically help us achieve our mission?
I think when someone comes to LSSI, and you're right, they could be working with a direct service person who's not a social worker. They might be from another helping profession. But when someone comes to LSSI in need of help, they have to bring to us some of the most vulnerable parts of their life, their disappointments, their mistakes, their traumatic experiences, even their hopes and dreams, which are also very, very tender, very vulnerable to share what you're hoping for or dreaming for in your life. And so people bring us this very tender material and situations that they're in. And I think when our staff, when our social workers can meet them there, it's really a sacred exchange. And that's the mission. That's responding to the gospel, bringing healing, hope, and justice to people and communities in that moment when that happens. And so I think social workers are really well suited for that. So are other helping professions as well. But I think when we create the environment where somebody feels able to share those kind of vulnerable hurts and hopes with us, then we're having the opportunity to promote their dignity. Think about ways that we can connect them to resources that will enhance their health and well-being. Help them think about, what it would look like if they could achieve their full potential. Those are our mega outcomes that we're trying to achieve. So all of that, I think, is how our staff, including social workers, help us achieve our mission.
Why is the profession of social work important in our society, in our culture, not just here at LSSI, but everywhere?
Well, I think social workers really enhance the fabric of our communities, strengthen the fabric of our communities. If you think about, that worker who is working with an individual and helping them change, a stronger person creates a stronger community. And then social workers who are working more on that advocacy level or more on systems change, when they create stronger communities, stronger neighborhoods, a stronger state of Illinois, then that influences people's individual lives as well. So there's kind of this synergy between the two that, again, back to that person in their environment. I also think social workers often get very adept at navigating complex systems because sometimes the very supports that are out there that are meant to help people can be very complex to get to. And so social workers learn to navigate those things. They're very persistent and resilient in the face of, bureaucracies or various things that maybe make it difficult for people to access those resources. And so, I think our staff, some of our very best staff, I think, are challenged by and kind of energized by trying to cross those barriers and help people get to the resource that they need. So I think that's, another really key role that social workers play.
Why do you like working at LSSI?
Well, I do love our mission. That attracted me to LSSI. I love the breadth of our organization, especially as I've moved into this chief operating officer role. And I go around the state and I meet staff and I go to the programs and I see what we're doing. And it makes me really proud to be working for a place that has such a broad array of services and so much expertise across so many different areas of life, age ranges of life and circumstances. And so that's really exciting and I think something that LSSI can be really proud of. The last couple of years, I've really loved how we're focusing on, in our Gen Care framework, the idea of the person served and the person serving, because even when I was that very young, new child welfare supervisor, I knew that if I didn't support my staff, they were not going to be able to turn around and support the kids and families that they were working with. So that just has always made a lot of sense to me. And so the fact that we're now really focusing on that and lifting that up in our work and really trying to build out what that means to center both the person served and the person serving, I think is really exciting. And I take a lot of energy from that. because I think, ultimately it really is the staff. That's what I love about working at LSSI, and probably a lot of people say that to you. But I really find it to be so true when I go around the state and I meet people and I hear their stories and I hear what they do at LSSI and the creativity that they bring. I think that there's just this common thread, sort of this invisible thread that I sense among LSSI staff that connects us, because even though we might come from different backgrounds or different educational experiences, different parts of the state, different professions, because not everybody who works at LSSI is a social worker. We need IT and HR and maintenance folks and support people and advancement and, all of those different dimensions, finance, to help us do what we do. But there's this kind of invisible thread, like I said, that, all of these people, we were all drawn to LSSI, to this mission, to this particular set of services. So just, to me, there's this kind of commonality that we sense in one another, that we kind of rally around, and that's very inspiring to me.